Hello everyone. In this video I am going to talk about pleural effusion. Now pleural effusion is a lung disease in where there is accumulation of fluid in the pleura. Now because of the accumulation of fluid there is restriction of the lung to expand, and as a result the patient has difficulty in inspiration and the patient lands up in breathing problem. Now the patient will clinically present symptoms with breathlessness. He will have cough and there will be production of pus along with the cough. Then the patient will have fever and also the patient will have exertion while coughing. Now regarding the treatment, at first we will ask the patient to learn how to cough. We will ask the patient to do active coughing technique. But if the patient is very weak and fragile and he is not able to cough out the pus actively, we should teach him some assisted coughing maneuvers. Now in these assisted maneuvers, we should ask the patient to use his own hands himself, or we should assist in coughing or expelling out the secretions with the help of our hands. And then before doing that, we should ask the patient to sit in a relaxed position with his back well supported, and then we should ask the patient to place his own hands in the diaphragm like this, and then take 3 deep breaths inside. And at the end of the third breath, we should ask the patient to cough out actively. And while he is coughing, we should ask the patient to give some pressure in upwards and inward direction. And the pressure should be simultaneous with the cough. And if the therapist is doing this technique, we should place our hands on the patient's abdomen, and at the end of the third breath, that is while the patient is coughing out, we should give a pressure altogether. So it should be like this. This will give some assisted pressure from outwards to the respiratory muscle and help the patient to cough out the secretions. And in the second line of treatment, we should ask the patient to practice some deep breathing exercise. The patient can do a diaphragmatic breathing technique, which will help him in doing more amount of inspiration and expiration. And for that the patient can sit in a comfortable position again, and then place his one hand in the abdomen and other hand in the chest and practice the diaphragmatic breathing exercise. In this situation, the glossopharyngeal breathing technique also helps a lot. So we can also ask the patient to practice the glossopharyngeal breathing, in which the patient will take in a gulp of air like this. This technique looks difficult at first, but as the patient practices it, later it becomes easier for him and gives him very good results. Thank you so much.